Hello, good evening, and welcome to the Functional Solutions podcast. We're so excited to have you. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have today Dr. Chill.
Hi, everybody. Welcome.
And Dr. Chill is a functional medicine physician with years of clinical experience in functional, nutritional, and herbal medicine. And every Wednesday evening, we connect with our healthcare community to discuss different topics in the functional medicine approach, and we kind of put together this discussion for you and share some really cool clinical studies and some of the root causes of functional medicine for these conditions. And of course, as usual, we're going to talk about treatment strategies that can benefit your patients. So I'm really excited. It's actually a fairly nice day here in Portland, Oregon. We can see the sky. It's clear, no rain, and it's sunny, which is really nice for October. How's things over there, Dr. Chill, in San Diego?
We got our sun back. So I know last week I went into a dark spell with the rain and the clouds, and it went really dark here really quickly. But the sun is still shining, and it doesn't look like it's going to be setting anytime soon. So it's great here.
Wonderful, wonderful. And we hope that all of you, wherever you are, you're enjoying the weather, you have good weather, and it's good to have you here. So in tonight's discussion, we have a very, very important topic, which is dementia. And this is a very important topic for several reasons. One of them being personally, as somebody who has been working with patients for almost 20 years in the field of healthcare. I've seen a lot of patients with cognitive decline and dementia and brain fog and Parkinson and Alzheimer's. And Dr. Chill, I know that you've been working with metabolic patients. A lot of metabolic patients and autoimmune patients and skin disorders. So I know that you had probably seen your fair share of older patients or geriatric conditions, right?
Absolutely.
So this is on a personal level. So we got some experience with utilizing the functional and nutritional and herbal medicine that we want to share with you today. But on a personal level, as I mentioned before, my real first introduction, not the theoretical, read it in the books type of a introductory to dementia and neurodegenerative conditions, was through my experience with a family member, my grandmother, who was there for me when my parents were working with two jobs and as immigrants who came in and had nothing to start with, and my grandmother was the one who was there for me so she was sort of like a second mom, and she was very smart. She spoke multiple languages, French, Spanish, multiple languages, very social. And we've seen that from the symptoms of declined memory within a few years to the full spectrum of dementia and Alzheimer's, which she no longer recognized the other family members, myself, her son. It's a very painful event to go through that, and to see how going through that as a patient, and where she was in the initial stages, where she still understood what's happening to her and that she's slowly fading away. And also as a family member who, just going to all these visits with the specialist and paying, there was one specialist we paid over $1,000 out of pocket. And I'll never forget it. They just looked at her, and it was the later stages, and they said, just make her, you tried this drug and this drug, and at this point, just make her feel more comfortable. And it was really painful for me to go through that experience. And one of our passion here in the academy, and I know Dr. Chill shares the same passion, is to show all of you a whole different world of therapies and treatment strategies and a root cause approach to transform that patients from continuing from where they are or keep getting progressive to improving their health. And I was so blessed through years of investing in learning functional medicine and nutritional medicine that when my father started developing those symptoms, and as I mentioned, it was very traumatic. We lost my grandmother within several years of the initial symptoms. She was in memory care, and then she passed away from all of these complications of Alzheimer's and dementia. But when my father started developing those symptoms, that was about 10 years ago, 8 or 9 years ago, and we all knew what it meant, right? And we know that there's genetic predisposition with these conditions, and we just didn't want to wait and see what happens, or wait until he qualifies for the drug, and then we know the path that he's going to go through. So we had him. He flew in to our practice. We worked with him for several months. And then within about 6 months, we were able to reverse his symptoms 100%. So it was quite remarkable. It was a very significant change. And now he's 80 years old and he's enjoying his retirement. He travels with my mom. So that's what I wish for all of us, these success stories, for all of you to have in your practice or with your family members of how you transform their health. So there's a few reasons why it's important, but that I wanted to share why it's really important for me personally to educate as many healthcare practitioners about the different treatments that are offered beyond the standard of care. So let's get into it. So just as an overview, dementia is very, very common. Worldwide, there's over 55 million people with dementia. The number keeps increasing. In the United States, it is estimated that in older Americans above the age of 65, 1 in 10 older Americans have dementia. And so it's very common. And as healthcare practitioners, we do believe that when a patient comes to see you and they struggle, yes, you can refer them to the neurologist or the specialist, but also providing them with additional treatment strategies to continuously improve their health and looking into the root cause is very, very valuable. It's valuable to the point where it could save some patients' lives. So it's very common. That's why we all need to know we all need to have a good understanding of how to treat it. The second reason is because dementia medication can be effective for some people, but they're not effective for anybody, and they typically don't work for long, right? So as the medication effect of the medication slowly reduces, the patient unfortunately continues to progress with their symptoms and the damage that is done, the neurological damage that is taking place. And of course, that we know that there's different risk factors. So we're going to talk about the risk factors. One of them being older age, right? So that's one of the major risk factors that we have. And we're going to talk about, so there's age and genetic, we know that, but there's additional risk factors. So let's take a look at this really interesting picture that is taken from Dementia Prevention, Intervention, and Care. And this is a report by Lancet Commission. And you can see here in this picture, there are 12 dementia risk factors. And you can see here physical inactivity, so sedentary lifestyle, for example, right? Smoking, excessive alcohol consumption, air pollution, head injuries. I just wrote an article about head injuries. and how even minor head injuries over time can cause significant long-term damage to the brain. Air pollutions, infrequent social contact, right? So individuals that are in isolation. So for example, if you look at some of the interesting articles that came out after in 2021, 2022 about the result of COVID and isolation, right? The COVID mandate, that restrictions that we had in 2020 and 2021, you can see a lot of those articles, a lot of these articles show that there was a significant deterioration in cognitive function, in mood, right? There's higher suicide rates. So we know that for our patients and for all of us as we age, we have to make sure that we have social interactions, right? So we keep friendships or going into clubs and share our hobbies with others, because that is really important. There's also patients that are less educated, at higher risk. Obesity, that's something that we talked over in much detail when we had the functional medicine weight loss summit, and we showed the multiple studies on how obesity, the fat tissue, is not just it's an actively metabolically active tissue that secretes hormones and secretes inflammatory cytokines that circulate in our bloodstream. So it's really helpful, and a lot of our community members learn how to offer weight loss program in the functional medicine, nutritional medicine approach. Hypertension and diabetes and depression and hearing impairment are another additional risks. And of course, we can get into each one of those independently. And we have specific class on how to treat those with functional medicine, nutritional medicine. But these are just a general overview, right? So when we get back to dementia, there are multiple factors, right? So we know that there's social, there's genetic, there's metabolic, right? There's multiple factors. And today we're going to talk about 3 of the major factors that unfortunately are not being discussed in the standard of care. And we're seeing studies that show that there's a strong association between these 3 factors and developing dementia or neurodegenerative diseases. So what we're going to focus today, and this is what I want all of you to get out of this discussion, is learn about the 3 major factors that could significantly increase the risk of dementia, and then what do we need to do about it, and what are the 2 major supplements from an evidence-based approach that your patients can use to continuously improve their cognitive function, right? So, Dr. Chill, it's a big topic, right?
It is, and I'm glad we're discussing this topic, because when you're working in the healthcare field and you work with a population, either at geriatric population that is at risk for cognitive decline, or just in general, your family members that might be at risk for cognitive decline, as you are fully aware, with your family members, this can significantly impact their day-to-day function and their day-to-day life. And this can contribute to emotional and lifestyle distress within the entire family. So it's a really important topic to bring up in the healthcare field, because there's so many factors that aren't being discussed. And I'm glad that we are going to discuss those factors, so practitioners such as the people who are here right now can understand all of these risk factors, all of these contributing factors, and then help their patients and their clients look at reducing the risk through assessing these risk factors. And with that stated, let's just go into the first factor that is a functional medicine approach for cognitive decline. We all understand inflammation, right? Inflammation is a necessary part of health. It's your body's typical reaction to injury, to pathogens, or stress. What The issue with inflammation, what can occur with inflammation is when it gets chronic. And it's this chronic inflammation that can lead to immune cell recruitment, fluid retention, tissue injury all over the body, including the brain tissue, and then eventually cell death. So, in the inflammation in the brain, there is a term for this. It's called neuroinflammation, and it has been identified and associated with many conditions, including dementia, mood disorders, and neurodegenerative conditions. So let's take a look at a picture really quick. And this is from the International Journal of Molecular Sciences, and this was published in 2022. So here we can see in the image that when a person is exposed to a neurotoxic agent, right? We see that in the picture here. It's going to stimulate the microglia, and then it's going to activate them. This is going to lead to activated microglia, and it's these immune cells in the brain that respond to injury. We see that here again, and or infection, and this is going to release cytotoxic substances, and this is going to clear damaged cells and then attack the infection. While activated microglia, these are important for your brain health, they can become stuck in an activated state. And then this is going to release cytokines and reactivated oxygen species, or ROS. And this could lead to the damage to our brain cells. And then over time, this can lead to neurodegeneration. And this is the whole premise of this picture there, from the factors all the way to neuroinflammation to neurodegeneration. And it's these neuroinflammatory responses that have an immune, a physiological, a biological, a biochemical, or a psychological effect. And aging and our genetic predisposition, as Dr. Cohen was talking about, this could place us in a more vulnerable situation to develop cognitive decline. But there are modifiable risk factors, such as our diet, our lifestyle, the environment. All of these have a play, and they have a significant role in developing neuroinflammation. So this is where we, as functional medicine practitioners, can come into play, right, and really help our patients with preventing some of this cognitive decline and preventing some of this neuroinflammation, because there's multiple causes of neuroinflammation. This can be exposure to toxic metabolites, autoimmunity, microbial infections, mold toxicity, cellular dysfunction. These are just a few examples and some factors that contribute to neuroinflammation. And to resolve this, we really have to look at all of the root causes of neuroinflammation, and we must find what those triggers are. And again, there's multiple triggers. And this is what functional and nutritional medicine practitioners do. And in the advanced and clinical functional and nutritional medicine program, you will learn about all of these root causes, all of the multiple contributing factors, all of the biomarkers in the specialty labs, and then the specific treatment protocols for them.
Wonderful. And this is really the foundation. What Dr. Chill was mentioning is really the foundation of starting to understand the damage. And if you remember just two factors, remember that there's something, let's call it a question mark, a certain factor or multiple factors that drive in that microglia activation, right? And this is just one pathway as an example. But once activated, it starts spewing out different inflammatory cytokines. Those cause damage to the tissue, right, by secreting reactive oxygen species, right? And then the damage to the tissue triggered more inflammation. So it's sort of like a vicious cycle, right? Inflammation leads oxidative stress. Oxidative stress leads to inflammation. So you got this vicious cycle that kind of feeds each other. And what we always want to do is figure out how we can modulate the immune response, because we want an acute immune response to a pathogen, for example, right, or an injury, right? But if that ongoing immune is activated, we got chronic systemic inflammation, or in this case, chronic neuroinflammation, then we're gonna see in the long term, we're going to see damage, right, and dysfunction. So, for example, the first supplement that we're gonna talk about have some of those, I would say, anti-neuroinflammatory properties that can help to modulate that, and we're gonna talk about that very soon. So, again, the question is, what's causing it, right? Because we know that just giving medication for a symptom, sending the patient home only to see them 3 to 6 months later, it's important. It's important for those patients to be managed, but it does not treat the underlying cause. And second, it does not improve the patient's health, right? So let's talk about one of those factors. I know Dr. Chill mentioned environmental factors, metabolic, mold toxicity, microbial infections that are not clearing properly, right? So let's talk about one major factor, which is factor number 2, and that's the gut-brain axis. This is a really interesting topic, and there are more and more studies that are coming out. We actually had a couple of experts in this field that was teaching in the gut-brain classes, and a new class that we recently added about long COVID and different treatment protocols through the gut-brain axis. And so it's a big topic. And there's really interesting studies that have shown us that there are multiple pathways that connect between our gut and our brain. This is a bidirectional connection, which means that changes in your brain could influence our gut, right? While changes in our gut could lead to structural and functional changes in the brain. I recently saw an interesting case study that reported that a patient with IBS that was prescribed SSRIs, and that helped to significantly relieve some of the symptoms of IBS, right? So that's one just very oversimplified example of how we can address the gut symptoms through addressing the brain. And then there are other interesting studies showing us that there's an association between changes in the gut microbiome and mood disorders such as depression or anxiety, right? So let's take a look at this really interesting picture from a published study in the Journal of Psychopharmacology. And you can see here in this picture, you can see the different pathways, right? And we're going to start from the bottom right. You can see the connection. There's multiple connections. There's one connection through the vagus nerve, which we're not going to dive into now. We have a whole 2 hours just on the endocrine and the connection and the vagus nerve connection between the gut and the brain. But here, what we're seeing on the bottom is how changes in the gut microbiome, and there are very specific. There's very specific data that shows that some microbial gut microbiome, some gut species of bacteria can lead to stimulate more inflammation. They can change our metabolism, right? While other can prevent that from happening, right? So if your patient has what we call dysbiosis, right? They even have too much of the opportunist bacteria or too low of the beneficial bacteria, what will happen is then there's going to be some metabolites that will be secreted, some inflammatory reaction, and that could cause increased react oxygen species, right, for free radicals, and then that inflammation will impact the permeability of the gut, right? So we got those tight junctions. Let's say this is a gut cell and this is another gut cell, and they're connected together. And in the middle, we have that tight junction, which is the door that opens and closes things and prevent things from going from outside of the body, which is in the lumen of the intestine, sliding or leaking into our bloodstream, right? And so if there is dysregulation of those proteins of the tight junction, right, because of inflammation, secretion of zonulin, whatever it is, right, those can slide through. This is what you see in the left corner in the bottom, increased gut permeability. Now, the problem with that is that it leads to LPS, which is, those are lipopolysaccharides, right? And lipopolysaccharides essentially are the major component of the outside of the membrane, the outer membrane of the gram-negative bacteria, right? So as these bacteria and lipopolysaccharides are sliding through the gut into the bloodstream, right, they bind to the TLR receptors. Those are toll-like receptors, typically toll-like receptors 4, on monocytes and microglia, and they start increasing the level of pro-inflammatory cytokines, right? So that can happen continuously, right? And that's one of the factors that leads to neuroinflammation and damage to the neurons and cognitive decline, right? Now, there are multiple issues that are associated with lipopolysaccharides, right? It's really important to know how to measure those. There are different ways to measure that. You can measure lipopolysaccharides antibodies in the bloodstream, for example, to see what's the reaction of the immune system, right? But there are 2 or 3 major issues with those lipopolysaccharides. One, increase of lipopolysaccharides in the bloodstream, right, would cause an inflammatory response, right? In fact, some of the published articles show that it will bring forward a very strong immune reaction, right? Second, lipopolysaccharide can cross the blood-brain barrier to some degree, but in small amounts, right? So there's one really interesting animal study. They did an intravenous injection dose of lipopolysaccharides, and they found that about 0.025% of that crossed the blood-brain barrier, right? Now, only a small amount crosses, but that small amount will already bind to microglia, and such as to receptors on the microglia, such as the CD14 or toll-like receptors 4, and that will activate signaling pathways that lead to the production of cytokines, type 1 interferons, and as a result, now you're getting an increase of reactive oxygen species and free radicals, which again causes damage to our brain. The other problem is that although we have very small amount of lipopolysaccharides that cross the blood-brain barrier, lipopolysaccharides over time can damage the blood-brain barrier function, which allows inflammatory and neurotoxic factors to enter the brain, right? So now we're even more exposed to those different neurotoxins. One of them, for example, could be heavy metals, right? So that's something. So it's really important to make sure that we, one, figure out what's happening in the gut, if there's an indication for that. There are specific signs and symptoms for small intestinal bacterial overgrowth. There's specific signs and symptoms for dysbiosis. There's certain signs and symptoms of low amounts of beneficial bacteria, right? You can actually measure these specific metabolites, right? We have a whole class just on that, on measuring what's the levels of the inflammatory versus non-inflammatory, what's the immune system is doing in their gut, right? So there are specific tests that look into that, and we go into all these biomarkers and the pathways. But it's really important to learn about the gut function, microbiome, and integrity from a functional medicine perspective, because it is a major contributor to so many chronic conditions, right? We've seen it with diabetes. We've seen it with arthritis. We've seen it with so many inflammatory conditions. And unfortunately, it's not taught in medical school, right? One of the things that we hear all the time from practitioners in our program is, I wish I would have learned this in medical school 20 years ago, right? Because I could have helped so many more patients that could benefit from understanding how to evaluate and treat those root causes. So, and it's really interesting because I didn't know that when I was going through functional medicine trainings several years ago. We would get those lab testing and look at the snapshot of the entire microbiome, or environmental exposures, or antibodies for specific things. And then I would refer them back to with the labs I would tell the patient, listen, these are the specific treatment strategies that we have to address that. Would you want to discuss it with your primary care doctor? Because we had physicians and nurse practitioners, but we chose in our practice to not do primary care, right? For our own reasons. And so we would tell the patient, listen, these are the strategies that we have. We'll educate you about what's happening in your body. It's really important for you to be proactive about it and for us to get real meaningful changes in your health. And would you want to share these with your primary care practitioner? And some of them would say yes, and they will send it back with their lab results. And it was always interesting. Like, I would say probably close to 100% of the time, the next time that I would see the patient, I would ask him, so how did it go? What did your primary care doctor or provider said when you showed them those labs? And the response was always the same. They looked at it and they just told me, keep on doing whatever you're doing. And that was about it. So it was really interesting to see that it's unfortunate that these pathways, this functional approach, nutritional approach, functional medicine labs, and the treatment strategies are not taught in medical schools or nursing school. And they would typically just send the patient back to us, right? And it's a big topic. So it's really important for all of us to keep advancing our skills so we can help more patients. And of course, even the topic of gut-brain axis, when I went through 3 different functional medicine programs, it was barely talked about, right? They might have mentioned it in one program, but they really didn't dive into it. So if you want to learn more about these different pathways when it comes to gut-brain, we have a very comprehensive class in our advanced functional medicine program. We go into the lab testing, the gut-brain strategies, and all of that. And also, just to mention that this weekend, we also have the Functional GI Summit, which is a one-day on Saturday where we kind of bring together a few experts to talk about functional gut disorders, some of the lab testing, the treatment protocols. There's a special class on the gut brain, and also treating skin conditions from the inside out. So that's all around gut health and gut function. If you're interested, we're going to post. We'll post the link to that here on the screen in a few minutes, and you can feel free to go into that link and check out this summit. We have an early bird price that we with a really big discount that we're offering everybody for attending this. So this was the gut-brain axis. It's a big topic, but just remember that if your patient have dysbiosis, it could also impact that neuroinflammation that Dr. Chill was talking about. So that was the second factor. And now we have another factor that is really important. And Dr. Chill, take us through the third factor, which is unfortunately also don't talked about in the standard of care, right?
That's absolutely correct. And this has to deal with nutrient deficiencies, right? And us as functional medicine practitioners, we look at all of these different varying factors because these are the important underlying factors. And another thing to discuss is that all of these actually can be connected, right? So as Dr. Cohen was saying, we now know that it's neuroinflammation that can lead to neurodegeneration. And then we now know that the gut-brain axis or imbalances of the gut-brain axis, and there's many contributing factors to that, such as dysbiosis, environmental toxins, heavy metals. The list can go on that can cause an imbalance of that gut-brain axis, which can cause the neuroinflammation that leads to neurodegeneration. Now, nutrient deficiencies can also lead to an imbalance in gut-brain axis, and it can also lead to neuroinflammation, which leads to neurodegeneration. So with nutritional deficiencies, the evidence is showing that it's dealing with B vitamins. We understand that the importance of B vitamins. You might have had patients who have B12 deficiencies and they have a lot of fatigue or chronic fatigue because it's a form of anemia, particularly macrocytic or pernicious anemia. This is no different with neurological issues. Vitamin Bs are really important for cognitive function, and then deficiencies in this can be linked to neurological issues, including dementia. So here is an image that I want to explain this a little bit further for you. This is showing the physiological systems. We can see all of those systems here where B vitamins are essential, right? We see that these vitamins are essential for lipid metabolism in the gray there, the Krebs cycle in the red there, and this is important for mitochondrial function where all the cells, including the brain cells, are. And then glucose metabolism, neurotransmitter synthesis, and epigenetic control. So, how does all of this impact cognitive function and decline? So, B vitamins, these are all tightly related to gene control for endothelium protection, right? We understand that their genes can be turned on or off, and nutrients are one of those factors that can turn these genes on or off. And with B vitamins, these can control the endothelium protection. They can act as antioxidants. They can play a coenzymatic role in the most critical biochemical reactions. This all happens inside the brain. And then they can cooperate with many other elements, such as choline. And this is all responsible for the synthesis of polyunsaturated phosphatidylcholine. And this happens through SAMe or S-adenylyl methionine donation. And this is all important for the brain cell function and the structure and the function of those brain cells. Now, B vitamins also have an anti-inflammatory property, and they can act as protection against neurodegenerative mechanisms. For example, they can modulate the glutamate currents and reduce all the calcium currents that can damage the brain cells and cause neurological dysfunction. So we now see that nutrients such as B vitamins are needed for neurological health.
Yes, absolutely. So this is a big part of, and this is a really important topic to discuss. And I really like that you brought in this picture because it shows us how certain nutrients are important for reducing each one of those risk factors, right? Mm-hmm. So we have, for example, specific B vitamins like B1, B12, B3, 6, which help us with glucose metabolism, right? That's an important factor when we want to address brain health, right? Or some B vitamins like B3, 5, 6, 7, which have antioxidant and anti-inflammatory, right? And of course, when we learn in our functional medicine, we combine nutritional medicine because it's all a part of the same thing, right? For example, B6 is important for absorption of magnesium. And we know that magnesium is really important for regulating neurotransmitters in our brain, for brain blood flow, right? For helping regulating oxidative stress and inflammation. There's also a really interesting association between higher magnesium intake and reduced risk of cognitive impairment, right? And then really interesting to mention that magnesium may help with brain health by increasing the production of neural stem cells, which is, of course, a part of our neuroplasticity, right? Is how our brain regenerates itself. So that's really important to know. From what we have tested, we used to test a lot of adults, patients, for micronutrients inside the cells, outside the cells, and what we would find is typically, I would say, most of the patients that we have tested have at least 2 or more deficiencies in very essential nutrients. And so that's a big topic. And of course, we have specific classes on micronutrients for chronic conditions. So we go over like each specific conditions, like hypertension, cognitive decline, high cholesterol, right? Which nutrients were beneficial for that, which nutrients are statistically deficient. So it's really important to make sure that our patients eat diverse diets so they get multiple types of nutrients, right? And making sure, especially if your patients are older, making sure that they consume a good multivitamin, right? A good multivitamin. Preferably, my favorite is for older patients is to do multivitamin in a powder form, not in a pill, right? I don't have any studies to back that up, but just from my own personal experience, when patients take multivitamin in a powder form, I've noticed, and this is again just my own personal experience, I've noticed that there's improvement that we might not see when a patient takes it with a pill or a capsule. So that would be typically my favorite, is to do it with a powder form, mix it with some water. And there are specific multivitamin formulations that are aimed and targeting brain health. So that's something that we teach in our supplements and nutraceutical class, more specifically, like what are the more specific multivitamins for formulation for brain health. So for now, just remember that all these nutrients are essential, and if patient is living on processed food, they're very likely, or they don't have diverse diet, it's very likely that they are deficient, right? So that being said, these are the 3 major factors. There are other factors, but we wanted to bring to you the 3 major factors so you can start looking at your patients from a whole different perspective of, 1, how can we modulate that inflammation? 2, what's causing that inflammation? And 3, how can we best support them for optimal function, right? And this is where we transition into talking about supplements. And the reason why we talk a lot about supplements is because while we do talk about dietary and lifestyle medicine and all of that, for many of us, not just patients, but many of us, it is easier to take a pill or a capsule or drink it in a formula or drink a powdered formula or a tincture than completely changing our diet, right? So many of our patients are taking supplements. Statistically, 7 out of 10 adults in the US are taking supplements. So patients are already conditioned to take pills or capsules. So it's an easier approach. Now, over time, when patients start seeing improvement in their symptoms, they're going to be more and more open to the dietary and lifestyle changes as well, right? So, Dr. Chill, let's talk about some supplements, some beneficial supplements. For the main one, as I mentioned, is really important for so many reasons, and it's also connected to neuroinflammation, right?
Mhm. Yeah. So with these supplements, what we're looking at is what kind of supplements can handle neuroinflammation in multiple ways, right? And when we're looking at these supplements as well, can these supplements be a big needle mover for the patient's health? And one of those supplements is curcumin. There are over 1,000 published animal and human studies, both in vivo and in vitro, of curcumin and the effects of various diseases, including Alzheimer's, dementia. The effect with curcumin is that it can reduce beta amyloid plaques, which has been shown to be one of the contributing factors for neurodegeneration. It can protect the neurons from degrading. It can help with chelating metals, which we slightly talked about in the beginning. It helps to reduce inflammation, and then it acts as an antioxidant. And then it can also inhibit microglia formation, which we also discussed earlier as well. And then it's been shown not only to be that protective due through those various factors, but it's also been shown to enhance overall memory in patients with dementia. Now, the studies are showing that that memory deficits at dosages of 20 and 50 milligrams per kilogram, this is while it's been administered, this can be shown to reverse memory impairments, and this is all a dose-dependent manner. And then with the higher doses exerting a more beneficial effect. This is at the 50 milligrams per kilogram. But the daily dose of curcumin for adults can range anywhere between 80 milligrams to 2,000 milligrams. And this is generally what's considered safe. And then you can also look at doing 100 milligrams to 500 milligrams twice a day. What we would recommend is to start with a lower dose and then slowly increase their dosage to see what their tolerance levels are. But as I was stating, when we're looking at supplements, we're looking at a supplement that can have multiple features to it, right? So with the curcumin, it's the beta amyloid plaques, protecting the neurons, the chelating metals, reducing the inflammation, acting as an antioxidant, inhibiting microglia, and then enhancing overall memory as well.
Wonderful. And that's a really good recommendation. And one thing that I'll add to that is that curcumin, there are some products that are better out there. So we have to remember that, one, we want our patients to take professional grade supplements, not off the shelf or over the counter supplements, because we have seen reports that with some of those products that were taken from different chains. I'm not going to mention the names right now, but some of those chains that sell over-the-counter curcumin or ginseng supplement were found to, when they tested them in a third-party lab testing, they found out that there was only traces of curcumin or ginseng in the capsules. And so in order for us to make sure that what's on the label is what's actually found in the capsule, we need to make sure that we recommend professional grade supplement companies to our patients. And we have a whole list in our clinical guide of what's considered professional grade, and those supplement manufacturers and vendors that have good manufacturing practices certifications, the GMP certification, and also they're third-party tested. Give you an example, Pure Encapsulation is one of them. Douglas Laboratory is another one. So there are, and MediHerb is another professional grade supplement. So make sure your patients are taking supplement grade. Otherwise, they're either taking fillers or they're taking capsules that might have other things that are undesirable in the capsules, right? And they're not going to get the results that they're looking for. So that's one thing. And the second comment I wanted to mention is that curcumin has a relatively lower bioavailability. So to increase the availability of curcumin, just look for a product that has piperine, which is essentially it's the active ingredient in black pepper. And those are, some products already have that together. It's combined together, like 5 milligrams of piperine together with curcumin, right? And that was found to significantly increase the absorption so you get more of a systemic effect rather than just an effect in our gut, right? So that was great. So let's go into the second supplement, and that's ashwagandha. Another name for it is Withania. And there was a really interesting prospective randomized double-blind placebo-controlled pilot study involving 50 subjects with mild cognitive impairment. And one group received 300 milligrams twice daily of ashwagandha root, versus the other group that received placebo, and that was for 8 weeks, right? Now, it's really interesting to mention that most studies will look at a minimum of 3 months. So we'll see what type of results this particular study have got, because it was this would be considered a shorter term. But after 8 weeks of study, the ashwagandha treatment group demonstrated a significant improvement in both immediate and general memory test when compared to the control group. Furthermore, the treatment group showed a significant improvement in executive function, sustained attention, and information processing speed. So, wonderful protocol to consider when you are working with patients that have challenges, that have cognitive challenges. Maybe they had neuroinflammation, maybe initial stages of dementia. So that's something that you can look into. There's another interesting study that I'll mention here. I just wrote an article a couple of weeks ago about treatment strategies for head trauma, and ashwagandha was one of those protocols that showed a improved recovery from head trauma. Right. So the dosage was 300 milligrams in this particular study. As usual, we want to make sure that we take under consideration mostly the patient's medication. So if they're on blood thinning medication, for example, then we want to go with a very low dosage and monitor them throughout time, right? Monitor them every week or 2 weeks to make sure that we're keeping that balance with the coagulation factors, right? And sometimes I would start with a patient with just 50 milligrams a day, right? A small amount if they're on taking multiple medication, just a small amount, longer term, while I work on the underlying root causes, right? And slowly integrate maybe every week or two, integrate one nutritional change and one lifestyle change, right? So that could be, for example, this week, can you add 10 minutes of walking after doing your lunch break or in the evening, right? 2 weeks later, can you add another one vegetable to your dinner, right? It's got to be leafy, some sort of vegetable that is not potatoes, right, to your meal. So what I've learned that works best is to utilize those protocols because they're very strong. And you can see here there's significant improvement with both protocols while working on the root causes, while slowly, very simple and slowly introduce just one nutritional or one lifestyle factor to your patients, right? If we overwhelmed, and I made that mistake when I first started working with patients, I would walk in and say, talk to them about their initial stages of dementia and what their health goals are. And then I would say, okay, we're going to reduce exposure to this. We're going to do this. We're going to remove this from your diet. We're going to cut all the sugar. We're going to do this. We're going to do this. And they would be looking at me with their eyes like they're in the lights, right? They would be like, where do I even start? And they feel overwhelmed. So we don't want to hand over our patients a list. I've seen practitioners do that when I shadowed in practices, and I've seen practitioners who hand over a patient guide and say, here you go. Here's all the guidelines and everything you need to do. And the patient just goes home. And while some patients might go home and they'll start implementing most of those recommendations, most of these patients would not, right? They already have cognitive challenges as it is, right? So what I would recommend is every visit, is have a support member that comes with them, take some notes. That's really important. In my practice, we always had a support member, right? Especially when a patient have dementia, Parkinson's, initial stages of Alzheimer's, always have a support member, their spouse, their daughter, their son, a friend, somebody that can take notes for them, and only ask them for one nutritional or one lifestyle changes at a time, right? And let them adjust to it. So that's just a few general tips to working with those patients. So this was a very important topic, and I know, Dr. Chill, that it was it's there's so much to learn about treating cognitive disorders, so much to learn about improving brain health, right?
Right. But these are just a few ways to begin with your patient, right? So a lot of practitioners, when they're doing the coaching sessions, they're always asking, how do I begin? There's so much information. And this is why we're doing these discussions, is to teach practitioners kind of giving them a starting place. And then they could dive into more information within the program.
Absolutely. And for any of you who wondered, how do I need to wait a whole year until I get certified with the advanced and clinical functional medicine program to start benefiting my patients? We're here to tell you that we have completely transformed our program. And for every practitioner who starts in our program, they get into the Quick Start program, where we give you from the beginning, we show you the foundation, we give you the clinical evaluation tools and the treatment tools, and you go on with one-on-one coaching sessions with Dr. Chill, and Dr. Chill shows you how to apply this in like real case studies. Like, you can take yourself as a case study. I know, Dr. Chill, we had quite a few practitioners, I think over 120 practitioners go through that Quick Start program, and a lot of them did their case studies. They took themselves through the evaluation, the functional medicine evaluation, right?
That's absolutely correct. They either did themselves, their family members, or they're already working with patients and they wanted to use the functional medicine approach right away, right? So then they'll send me the functional health survey. We'll go through that together. I'll go over the functional health survey with them, and then I'll guide them on what to do as a practitioner when you're looking at that functional health survey. How do you use this as a tool? How do you use this to guide you to figure out what labs to do, how to prioritize the labs, what treatment approaches to start with, right? And then as you're doing that over and over, you get to see the pattern of functional medicine and how to put this into your clinical application. And I have practitioners sending me their case studies on a weekly basis because they want to feel really comfortable in functional medicine. So by the time they're done with this program, they're good to go.
Absolutely. And that's what we're so proud about, giving you all the tools that you need. So when you get into the program, the clinical program, you're not just getting started and experiencing functional medicine from your first month in the program, but you're also getting all the consultation forms, the legal forms. You get templates for marketing. We essentially provide the whole comprehensive approach, both the clinical and the practice building, because we want you to succeed. And we also understand that, you're probably seeing patients right now who are chronic. Some of them keep struggling, and we want to offer them help as soon as possible, right? So this is why having those one-on-one mentorship and coaching with Dr. Chill is incredible, because you can benefit from that greatly, and your patients as well. So one more thing that I wanted to mention again is that our Functional GI Summit, or this weekend on Saturday, it's starting early. It's about 7 hours, around 7 or 8 hours. We're starting early. And this is going to be an amazing summit where we bring in experts. Dr. Chill is going to be there. He's going to be teaching specific case studies to show you more about how changes in the gut can change increase our weight, cause weight gain and skin disorders. And we got another doctor who specializes in gut-skin axis and how to treat your skin from the inside out. And then we also have Dr. Coviola, who is teaching the specific class on the gut-brain axis. So it's going to be awesome. You're going to get the updated treatment protocol guide for GI disorders. So you'll have all of those treatment protocols there. And you can go to www.my.theafh.org/functional GI summit. So the link is on the screen. Feel free to go to that, or you can just reach out to us, the American Academy of Functional Health. If you got any questions, you can reach out to us. You can call us. We're here every day, Monday to Saturday. And for any of you interested going deeper, getting certified, open a successful practice, we are here for you. Both me and Dr. Chill, the entire team are here for you. We got all the tools, the strategies. So this is what we're passionate about doing. So with that being said, I want to thank Dr. Chill for putting it together, this discussion, sharing his years of clinical experience. And of course, I want to thank our media team and Jacob, who without them, who always every week as usual do their magic to bring all of us together. And remember, we're with you every step of the way to get better and better clinical results, right? Become the health expert in your community and helping you get certified in functional medicine and build a successful practice. So thank you for joining. Hope you take care. And again, thank you everybody for being here.